2-1.
So the last part of the session is considering special needs for specific populations. The first one is high blood pressure. What is high blood pressure? High blood pressure is basically any blood pressure that is consistently over 140 over 90 millimeters of mercury. There would be various stages above that again. Anything over 200 systolic blood pressure, I wouldn't be training them. Automatically referral to a doctor. Anyone with a systolic blood pressure of 150 or greater, again referral to a doctor, but they could be considered a client within specific training guidelines from the doctor. Of course, in comparison, an ideal blood pressure, which is 120 over 80. So considering that population who do have an elevated blood pressure up to 150, after referral to a medical specialist, and then specific guidelines on what they can and can't do, these would be some of the considerations or modifications I would include. Basically involving both cardiovascular and strength training, and using the FIT principle in regards to cardiovascular training, frequency, training 3 to 7 days per week, with an intensity of 40 to 70% of the heart rate max, and using the rate of perceived exertion scale between 11 to 13, depending on that individual. Time frame for a session, half an hour to an hour maximum. Resistance or weight training schedule, 2 to 3 days per week, using a low resistance because we don't want to stress that heart muscle too much. We have something like 8 to 12 exercises using 8 to 15 reps with a 50 to 60% of their 1 repetition maximum. Good range of motion still, with a nice slow controlled regular tempo. Overall, the whole session should take less than 20 minutes, considering a 48-hour period between sessions, and 1 minute to a minute and a half rest between sets. Very important. Contraindications, obviously, if this person started to exhibit or complain of any of the following signs and symptoms: chest pain, shortness of breath, pain radiating up into the neck, down into the arm, across the chest or back, nausea, any changes in their skin colour or their moisture, so if they look pale, cool and clammy, and if they complain of any abnormal heart rhythms they're experiencing. It'd be very important to get a very accurate history when you're first interviewing this potential client, looking at their family history, medical history, surgical history, their training history, what they've been doing, any medications they're on, any known triggers that may cause them chest pain, and then calculating their potential heart rate maximum, and talking them through the rate of perceived exertion scale so they can understand how they feel and they can give you accurate feedback of how they're feeling during training. And again, it's very, very important to get medical clearance when potentially treating or training someone with high blood pressure. The next group we have to talk about in regards to specific populations is lower back pain. Lower back pain, what is it? Well, we all probably experience at some point, or indeed apparently 70% of the general population will experience it, and it is often a common complaint amongst various athletes and sports people. Possible causes: any damage to the vertebral bodies, which is the actual bony component of your spine, so fractures, spondylolysis. Some of the soft tissues, you could have disc bulge, herniation of the disc, nerve root compression, strains to or sprains to muscles, tendons and the ligaments, congenital defects, so something that people have been born with, not aware of, and as they mature and evolve and then start to get active, then they actually have some problems developing. Hypermobility through the spine, or muscle imbalances. So as a personal trainer, it's very important again to do a very accurate history when you first engage with this client, doing postural analysis, gait analysis, movement analysis. Some of the contraindications would be no bending, twisting, really maintaining and focusing on a neutral spine and position, monitor their form throughout the exercises, and some of the modifications would be designed to strengthen the core and the muscles and ligaments and tendons surrounding the trunk and spine before going on to dynamic movements. really think about strengthening and stabilising and the functional capacity of the spine before engaging in traditional big compound movements. Thank you. The last group that we need to talk about with modifications for specific populations is shoulder pain. So what is shoulder pain? Shoulder pain can involve either the structures around the shoulder joint itself, or it could also include the scapula. You can also get shoulder pain referred from the neck and also the upper thoracic area. Again, it can be due to an active lifestyle, some sort of injury, or even congenital, some problem that people are born with, and as they mature and become more active, then problems evolve and develop. Quite often, shoulder injuries will involve or would refer to the rotator cuff muscles that basically stabilise the head of the humerus, and those muscles are the supraspinatus, infraspinatus, teres minor and subscapularis. Basically, they control the head of the humerus in that shallow cup of the scapula, which is called the glenoid fossa, and they counteract the actions of the deltoid muscle. So there's a lot going on in that shoulder joint. Injuries can be acute or chronic, or indeed a combination of both. So again, as a PT, you really need to get an accurate history of what has happened and then the signs and symptoms of what your client is complaining about and is unable to do. Acute injuries could be muscle sprains, tendon tears, partial and or complete. Chronic problems could be examples of tendinitis, tight muscles, and balances between muscles as regards to strength and activation, or both. So the aim of contraindications, obviously we're not going to do anything above head initially. We're not going to do any sort of ballistic movements, and we really want to focus on being able to strengthen and stabilise the scapular and shoulder muscles so they can do the work that's required without pain before we start to consider going overhead or long arm extension work. So avoiding anything above shoulder height initially, and also there's other therapies, so referral to physiotherapy and or medical practitioner if scans are required, getting clearance from those professionals, guidelines as to what we can and can't do, and thinking about other complementary therapies, so heat therapy, cold therapy, trigger point therapy, maybe some strapping, use of oral or topical anti-inflammatories, obviously under the direction and guidance of a healthcare professional, to all work in tandem with the rehabilitation work that we're doing in order to get those muscles strong and complementary with the other muscles of that joint before we start applying that into activities again and then graduating it up over time. Thank you.